Assalamu alaikum. My presentation is about posterolateral versus posterior antibody fusion and lumbar degenerative spondylolisthesis. As you know, the ideal surgical treatment for spondylolisthesis still remain controversial. Posterolateral fusion using pedicle screws has long been the gold standard for surgical treatment of degenerative spondylolisthesis. Interbody fusion techniques have increasingly gained popularity for treatment of spondylolisthesis because of the benefit, providing anterior column support, 360 degrees fusion, indirect foraminal decompression, and restoration of the lumbar lordosis. Our study was carried out to determine whether posterior lumbar interbody fusion is associated with improved patient-rated satisfaction and functional outcome when compared with posterolateral fusion. Our collected data is between January 2007 and December 2012. It was carried out at London Health Science Center in Canada. It was a retrospective study of 2 different fusion techniques for the treatment of lumbar degenerative spondylolisthesis. There was 87 patients. All had single-level degenerative spondylolisthesis, either posterolateral or interbody fusion, were identified from a retrospectively maintained database. So the outcome was short form 360 PCS and MCS and disability index, back and leg pain, and complication. Inclusions include degenerative spondylolisthesis, single level with single level fusion. These are our exclusion, which include multiple level spondylolisthesis or multiple level stenosis or multiple level fusions, or ischemic spondylolisthesis, inflammatory back pains, and patient who had severe or progressive neurological deficit, which require urgent or emergency surgery, cancers, previous lumbar surgery, and inability to complete questionnaires in the follow-up. The results were, a total was 87 patients. The posterolateral was 29. The interbody fusion was 58. These are a little bit significant, but it's still the women were more in the interbody fusions, but still the p-value was not really significant. There was 11 patients in the interbody fusion, so who has diabetes, but still it did not reach the significant value. There was patients who were having claudication more in the posterolateral fusions, and more who are having radiculopathy with claudications in the interbody fusions. The patient who had foraminal stenosis were more in the interbody fusions in comparison to the posterolateral. Also, the L3, L4 level were more in the posterolateral fusions more than the interbody fusions, and also a level of L4-5 stenosis, and were more in the interbody fusions. The rest were insignificant. There was 3 patients had a dural tear in the interbody fusion in comparison to posterolateral, but again, that was not really significant. There was 3 patients who died 6 months, more than 6 months after the interbody fusions. There was none in the posterolateral. Those who died were not related to the procedure itself. The fusion rate was 93.1 in the interbody fusions and 89 in the posterolateral. The outcome was almost the same in the SF36 in both groups. ODI was the same, back pain and leg pain was almost the same. There was no significant difference. So there was limitations. Of this study is influenced by the selection bias, as the surgeon choose which technique to use at their own discretion. Of course, there was a small number of patients in the PLF group. And I conclude this study found no difference in clinical outcome between pedicle screws and instrumentation with or without interbody fusion. A large prospective multi-center trial will aid in providing better scientific evidence to ascertain which fusion technique has the lowest complication rate. Thank you.